Okay, pet parents, because I can almost guarantee you that most of you have had a pet that's been diagnosed with this, let's talk about the famed and fabled GI disease that is pancreatitis. When talking about pancreatitis, we can make it as complicated or as simple of a discussion as we want to make it. Now, because the complicated side can be hella complicated, we're going to stick to the simple side and just say pancreatitis is inflammation of the pancreas. Simple enough and done. And even though there's a ton of different underlying causes of pancreatitis, a lot of times we don't find what actually caused it. The pancreas itself is this funky and sensitive little organ in the middle of the abdomen that's responsible for releasing digestive enzymes that help us and pets break down their food. And the pancreas also helps us regulate our blood sugar. Ain't no way I'm getting diabetes. My mama says I'm already sweet as sugar. Regardless of what's causing it, with pancreatitis, one of two things is happening. Either A, the mechanisms that tell the pancreas to stop releasing the digestive enzymes aren't there, so essentially nothing's telling the pancreas to stop doing its job. Hey there, pancreas, look, you're starting to digest the kidney there, and it's making some of the other employees just a wee bit uncomfortable. Yeah, so we're just gonna need you to clock out early, okay? Or B, the enzymes that the pancreas normally releases to break down food become activated inside the pancreas, and it starts digesting itself from the inside out. Oh my God, it's coming out! Sorry, that was an Aliens reference. Most of you are probably too young to get that. Super gross. The clinical signs of pancreatitis are typically pretty straightforward because it's a disease of the gastrointestinal tract. Most of the signs are going to be associated with that. Diagnosing pancreatitis can be just a little bit tricky because even though there's a whole bunch of different blood tests and different biomarkers that we can look at on a routine blood panel, the sensitivity and specificity of those guys are all over the place. However, most of us are going to diagnose pancreatitis based on clinical suspicion, our history, and our exam findings. Now, if your pet's hospitalized, we will recommend doing an ultrasound so that we can visually see the pancreas, but even that can be misleading at times. On paper, treating pancreatitis is extremely straightforward. We treat whatever clinical signs are present. And even though most pets can be treated as an outpatient basis, so many pets each year require hospitalization for treatment of pancreatitis because of how complex of a disease this can be. And because of the severity of some of the complications that happen with pancreatitis, in some cases, even with the most aggressive hospitalization and care on the planet, pancreatitis can still be fatal. Pets that recover from pancreatitis are going to be sent home on a low-fat diet, and they're going to be just fine. However, they are going to be more predisposed to having episodes in the future. Hopefully, though, with a little bit of luck, you won't have to deal with the complicated side of pancreatitis.